Hi there, everybody. So my name is Fahd Kuhal. I'm a consultant ophthalmologist at Moorfields Eye Hospital here in Dubai. I moved to the UAE around 2 years ago, but actually my previous incarnation, I was a consultant ophthalmologist at the Royal Hallamshire Hospital in Sheffield. My passion or my interest in laser pen-induced injuries really started on Boxing Day, where I saw a young child who, unfortunately, one of his parents had bought a laser pen as a stocking filler, being sold on Amazon um, as a laser pen with a safe output. But unbeknownst to them, it was a powerful laser pen with anything between 40 to 60 times the output that's deemed safe for consumer use. And unfortunately, the child shone it into their eye, so it was self-inflicted macular injury. But what was interesting about the case was at the time, I didn't believe that a laser pen could induce vision loss or induce a retinal injury because we'd been used to the low-powered laser pens that we've been using in lecture theaters and in conference halls. Um, but no, this was a new breed of pens that were imported from abroad um, that did not meet the consumer standards and were able to cause injury. And then after that particular child, who actually did very well with steroid therapy, and because we caught it early, we then kind of noticed an epidemic of these cases in Sheffield because kids enjoy shining shiny things with light outputs, and they're being sold as laser pens that are so-called safe, but they weren't. And for about a year or two, we were seeing regular laser injuries. And then I took out that interest and spoke to my colleagues in the UK and across Europe, and we found a real spike in these injuries. Obviously, working with the UK government and public health, and particularly the lead advisor for the UK government on laser safety, which is Professor John O'Hagan, we were able to share a message to parents, particularly at Christmas, not to buy laser pens. And we think the message got through. But I have to say, in the last few years, there's been a real slump. And I don't know whether that's part of it is due to the effective messaging. So the message got through, don't buy laser pens because they're unsafe, or whether kids just moved on to a different fad. Whatever it is, it has the incidence is less frequent, but it's still there. And I think it's still important that people are aware of the dangers of laser and laser safety. So certainly in Sheffield, we, I reckon up to 100, 120. It was kind of, if that's an exaggeration, I apologize, but it was almost 3 or 4 a week over a year or 18 months. Fortunately, most of the injuries were mild, so the vision did recover fully, in fact. However, it was very distressing for the child, very distressing for the adult who accidentally shone laser in their eye because they've got a blur in their central vision that can take several weeks to clear. So obviously you've got the anxiety whether you might go blind. But even though the laser injury recovered, when we interrogated these eyes and we tested the sensitivity of the retina using a technique called visual field perimetry, or a more refined technique called retinal microperimetry, where we expose the retina directly in the area that we're interested in testing with light and seeing how well they can see that light and perceive that light. We found that they needed a much greater intensity. So basically, they'd reduced their sensitivity to that of a 60 or 70-year-old because of that one very brief exposure to laser light. But yeah, it was a definite epidemic, and it was definitely a worrying time. And so there was a lot of media interest, and there was a lot of opportunity to go on TV and radio, both locally and nationally, to share the message. And we think the message got through because we didn't see it in the subsequent Christmases, but we don't know whether it was the public health message, which the UK government gallantly supported, or whether it was just that the kids had moved on to something else, and whatever it was, I'm not. We certainly saw a drop in incidents, but it still trickled through. So I once had very early on in my time in Sheffield. So this is before we discovered laser pens could cause injuries at the back of the eye. I saw a young researcher, a PhD student, at the University of one of the local universities in Sheffield, and he was y- doing research using a laser, and he was trying to align the laser beam because obviously in university research labs, these laser beams are kind of exposed, and there's lots of mirrors, and he was trying to basically align it, and he used his own eye to align the laser burn. And unfortunately, or fortunately, so unfortunately, it did injure the retina, but fortunately, it was outside the foveal area. It was outside the line of sight. So he noticed an abrupt shadow in his vision. He came to eye casualty immediately and obviously was referred to me as the retina consultant. And what we'd identified was a disruption within the retina that you could see clinically, but fortunately was not within the center of the vision. So his central vision was not affected, but he was aware of this blind spot outside. We were able to take a retinal OCT, which is a retinal scan of the back of the eye, which confirmed the retinal injury. Fortunately, over time, it just settled down and recovered. And actually, he was no longer aware of this blind spot in his vision. However, we had to maintain regular follow-up for this case because unfortunately, once you've exposed the retina to any injury, be it light, be it the sun, be it trauma from a punch, it could be an injury from disease like age-related macular degeneration. But once you've injured the outer part of the retina, it can increase the risk of developing a complication called choroidal neovascularization, where because you've injured the eye from whatever means, be it disease or be it from a light exposure, you can develop abnormal network of blood vessels that grows from the outer retina into the inner retina. And that can really threaten your vision because then you get bleeding, leakage, fluid at the level of the photoreceptors or at the levels of the, the cells that are important for seeing. And that can lead to irreversible vision loss. But most people would be switched on enough, hopefully, to identify a problem of distorted vision and come to the doctor. But even if you can rescue their vision with injections into the eye, you're needing several injections for an injury that never needed to happen in the first place if you followed laser safety guidelines and followed your local laser protocol guidelines to avoid a retinal laser injury. So as a retina specialist, people lose eyesight because of a vein occlusion due to blood pressure or due to diabetes, or they lose vision due to diabetic retinopathy, or they'd lose vision due to age-related macular degeneration. But these are the diseases that they can't help, that, that they can't avoid. And life afflicts retinal problems on you that need to be addressed. But a laser injury, a laser retinal injury, is something that absolutely can be avoided if you follow the protocols, if you follow the laser safety protocols.